Dr. Scott, welcome. And you have the floor.
Thank you, Chairman. It is an honor to be here this afternoon. Great to see the committee and everyone who is watching, and of course, Lynn. Thank you very much also to the team of people, not only who helped us in preparing this, but who was also actually out there doing the work on the front lines. It's certainly on their behalf that I'm honored to be here today and share where we are with COVID-19 and our vaccine and overall update. So I'm honored to have Dr. Phil Chan, who's one of our esteemed medical directors at the health department and a colleague of mine for many years and with infectious diseases as well, who's going to get us started with our data update and vaccination campaign overview, and then I will be able to go in further with what we are doing with our vaccination campaign rollout overall.
Great. Thank you, Director. Thank you, Director, and good afternoon, everyone. It's a pleasure to be here in person. I'm going to start off just talking about some trends and update on the Delta virus and where we are with cases. So you can see here on slide 4, this is a summary of our very tough winter. As everyone knows, we had a very high number of cases, hospitalizations, and deaths. It was a very tough winter, 2020, 2021 here. In the summer, starting in June and July, again, slide 4, you can see that we bottomed out. And so we were beginning the summer started well. But unfortunately now, we've gone back to another peak. And you can see the significant increase across both cases, hospitalizations, as well as deaths now, slight uptick through July and August. Next slide, please. What is to blame for this? The Delta variant is to blame, and I think that there's really no question about that, and the data supports that both here in the state of Rhode Island as well as across really the world and the United States. If you look at the orange now, the orange is the Delta variant. And I guess what's really striking about this graph here is that the red line, if you back up during the winter, the red line is the Alpha variant, B.1.1.7. That was a variant that was first identified in the UK. It was 50% more infectious than the original strain of COVID. And the problem is the Delta variant is 50% more infectious than the Alpha strain. So you now have a variant, the Delta variant, which is 2 times more infectious, and that's why we've really seen it spread like wildfire throughout not just Rhode Island, but across the United States and the world. This was the variant that was first identified in India. For those of you that have followed COVID on a worldwide stage, India was essentially overwhelmed with their hospital systems. You couldn't get oxygen, you couldn't get a hospital bed, et cetera. So what's blunted this peak in the country, including Rhode Island, has really been vaccinations, and that's obviously the key, and we'll talk a little bit more about that. But you can see here the Delta variant is the real thing, and it really had the potential to devastate everything, both in terms of deaths, hospitalizations, et cetera. Next slide, please. So let's talk a little bit about what our models have shown us. And I want to preempt these slides by first saying that models are just that. These models change every day. They're based on the best available data, and they're just that. They're models. So we need to take these with a grain of salt. These are where the models stand currently. And I want to say first off is that we've been following these models. We basically get daily, weekly updates of these models. And looking at these models over the last few weeks, these look a lot better than they were. So these models initially were projected to be much worse. We were really concerned about hospital capacity. These models showed that we were going to overwhelm hospital capacity. It's why we've worked to set back up the alternate care sites. So we believe that we're in a much better place. But I just want to, again, caution people as you look at these numbers that they are based on some assumptions and they're based on where we are. So if you look at these slides, the first slide here, if you want to go back, yep, we see the number of cases, total cases in the state of Rhode Island, which represents both people that have been diagnosed, so those are the actual people that we see, as well as people that are infected and have not been tested. And so as we look at the number of people that test positive on any given day, that of course is a minority of the people that are overall infected in the state. And we estimate, you can see here, that for any given day is that there's about upwards of a few hundred cases per day here in the state of Rhode Island. You can see on the second panel here, this is prevalence. So this is the number of people that are infected on any given day in the state of Rhode Island. And that means not just diagnosed, but people that have been diagnosed for a few days and that are still somewhere within their course of illness. And you can see here that we still have a significant burden of people living with COVID here in the state of Rhode Island, certainly around 6,000 or 7,000 at the current time. Now the good news is that we have seen a little bit of a leveling off over the last few weeks. If you look at sort of where we are and where we've been the last few weeks, the slope does appear to be decreasing slightly. We have talked with our modeling team and our data people. We are seeing and we are concerned about a little bit of a bump due to opening of schools, so both K through 12 as well as colleges and universities. As some of you may have read in the paper, there was a slight bump at some of the local universities who identified a number of asymptomatic cases, and then there's Labor Day as well. So we are seeing in the last few days potentially a slight bump up in cases. So we're not out of the woods yet. The other thing I'd like to mention is that based on these models, that some of the tactics, some of the strategies that we have implemented, such as masking, such as other approaches, have really, again, blunted the peaks. So the modeling of these peaks, of these cases, were much higher if we hadn't implemented things like masks, access to testing, et cetera. So that's just another point to make. Next slide, please. Please.
If you could remember that you have 2 slides up there. For the people that are watching, please explain to them the first chart versus the second chart so that they're just not looking at a chart and not understanding where you're at. We can see you, but they may not be understanding what chart you're at or you're on. So just to be a little bit more clear to the people who are watching.
For sure.
Thanks.
So just again to state, on slide 6, if we want to pull that up, on the left-hand panel are the total number of people diagnosed per day in the state of Rhode Island. And so this is higher than what you may see on our website in terms of positive tests. This takes into account the total number of people that may not even been tested. And then on the right panel are the number of people who are living with COVID at any given time in the state of Rhode Island. So that includes people that may have been diagnosed 5 days ago that still have COVID, et cetera. So you can see that we still have a burden of disease at any one time in the state of in excess of 5,000 or 6,000 at the current time. Next slide, please. One thing that we've been concerned about is hospital admissions. This has been a key point, obviously. Many of you have probably seen stories in the media about, in other places, not Rhode Island, about people that have died, frankly, because they couldn't have gotten access to medical care, not just for COVID, but things like heart attacks and strokes. If our hospital system becomes overwhelmed, mortality increases because people can't get access to basic medical care that they normally would. So we've been following hospital admissions very carefully. You can see here on the left panel on slide 7 that initially back in August that we were really having an exponential increase in hospital admissions. This was incredibly concerning as well, and we talked with the hospital leadership, and it was pointing to the fact that the hospitals were going to be overwhelmed this month. The good news is that hospital admissions have leveled off a little bit, you can see here, but we are still seeing, depending on the day that you look at, a significant number of hospital admissions. So it does look like it's plateaued a little bit. Again, though, we are worried about a slight bump in cases that we have seen as a result of Labor Day, as a result of K through 12 college and university opening. On the right panel here on the slide, you see hospital census. So this is the number of people admitted to the hospital, in the hospital at any one time due to COVID-19. And you can see here part of this is dependent on what the average hospital stay is, and you can see here it's modeled to be around 7 days. And you can see here that we again are somewhere it's decreased slightly. We're still in a little bit of a plateau period, and it's early to tell. Again, these models do tend to change, so let's take them with a grain of salt. Next slide, please. This is also a really important slide relating to the number of deaths due to COVID here in the state. You can see in June and early July, we had actually hit a low point, which is good, between 0 and 1 deaths per day. You can see that that has ticked upwards, certainly during late August here, early September. We had a max of 6 deaths on a given day due to COVID, but it also appears to have leveled off. The one thing I will make a note about this is that deaths, of course, do lag a couple weeks behind hospitalizations, which also lag behind diagnoses. So we have learned to also take some of these trends, and they need a little bit of time in order to tell the true story, the trends, et cetera. Next slide, please. Our vaccine campaign. So let's talk a little bit about where we are. So very exciting this week. I'll start with the exciting news, is that Pfizer did announce, certainly for 5 to 11-year-olds, present some data, release some data to the public, which is being reviewed as we speak by the FDA. But the good news is that we do anticipate authorization of the Pfizer vaccine, hopefully this month for 5 to 11-year-olds. So that's something that we are preparing for. Perhaps the director can talk a little bit more about that in a second. But where we are now, I think as most people know, is that we do have a fully authorized vaccine for age 16 and older, the Pfizer vaccine, which was fully approved last month. We also have that same vaccine that is authorized by the FDA for 12 to 16-year-olds. We have the Moderna vaccine, which is authorized for 18 and older, and they've submitted for full approval, and the FDA is evaluating that now. And then we have the Johnson & Johnson vaccine, which is also under EUA for age 18 or older. We know that all three vaccines are incredibly protective. If you look through the scientific literature, there's like an article a day now, probably a couple articles a week, a couple big articles a week, that have looked at the effectiveness of the vaccine in real-world clinical settings, healthcare workers, first responders, et cetera, that demonstrate how effective this vaccine is, not just in terms of efficacy, but also safety. These vaccines are really incredibly safe. So it's something to be reassured about. Again, I have a 10 and a 14-year-old. My 14-year-old has got the vaccine. She got the Pfizer vaccine when it was first authorized for those above 12. And my 10-year-old will get the vaccine as well when it's authorized for the age group. And believe me, obviously I wouldn't do anything to put my kids in jeopardy. I believe I've reviewed the safety data, the efficacy data. It works, it's safe. And I just want people to be reassured about that. The other good news I just want to highlight is that Rhode Island does maintain one of the highest vaccine administration rates in the country. And this is really a tribute to the entire state of government, Department of Health for sure, but also the governor's team and all the partners that we've had, all of our clinical partners in getting the vaccine out. We really have, I believe it's ranked number 5 in the entire country in terms of vaccine rates. So we've done a good job overall. Also tribute to the people out there just getting vaccinated and being willing to do that. Next slide, please, slide 11. So where are we now? So at the current time, as of yesterday, 66.6% of Rhode Islanders are fully vaccinated against COVID, and that includes about 78% of Rhode Islanders 18 and plus who are fully vaccinated. 74.2% of Rhode Islanders are partially vaccinated. You can see here that's 86% plus of 18 plus year-old of Rhode Islanders. And this also aligns with the federal COVID plan, and many of you probably watched the Biden speech the other day, but vaccinating the unvaccinated has really been a key priority, and we're really pushing that. The vaccine is the way that we're going to end the pandemic. It's really effective, it's safe. We really need to push the vaccine as much as we can. And this also goes along with booster doses, so this is also a moving target. One of the things about the science, as we've all seen with the pandemic, is that the science is evolving. It's evolving, frankly, at an incredibly rapid pace from week to week. We know that booster shots are authorized for people that are immunocompromised, and we're waiting on the FDA and the CDC to make an announcement about their thoughts about booster doses for example, older adults, healthcare workers, et cetera. So we're still waiting for some guidance from the FDA, the CDC on that. And with that, I'll turn it over to the director to talk about our current vaccine campaign efforts. Thank you.
Excellent. Thank you, Dr. Chan. We wanted to be able to highlight that with boosters, we have a full comprehensive program that our team is prepared with across operations, vaccine administrator readiness, supporting all of the functions that are needed, and any of the key considerations. So we'd be happy to go through any of that detail. We're staying very close to our federal partners as it unfolds. So I want to be able to dig in a little bit further on how we have approached our campaign overall and where we are in that full campaign strategy. We look back on our previous times together. We had phase 1 of our vaccination campaign that came under a lot of heat because of the approach to really be targeted, to really focus on those that are most vulnerable and at highest risk. And we all saw together being pleased with the outcomes of having the greatest drop in our hospitalizations and fatalities in the quickest amount of time. We're among the states that did that, so it was worth the approach. Our phase 2 then went into vaccinating not only our highest risk and taking into account the equity perspective, but then also built in phase 3, which was getting out as many vaccines as possible as quickly as we can. And knowing that that's a key piece, it's since that time that we have been at the front of the line in terms of vaccination rates. Where we are with phase 4 is, in addition to really getting into the level of granularity and meeting people where they are, we are also now focusing on those policy solutions, which is a critical public health tool that has made it so that we have been leaders in immunization since the very beginning, for a couple of decades. And so really applying some of the policies in place to help shift our culture and work it into a normal approach for getting vaccinated, because that is what's going to be key to getting us through this pandemic and allowing our schools and our economy to function as effectively as possible. So digging in on that phase 4 and looking at the key drivers for increasing demand, particularly looking at the policy approach, we're certainly going to be ready with the advancement since the full FDA approval in terms of supporting policies that require vaccination. Similarly, it is effective for getting back to school, and what was just shared for those younger than 12 becoming eligible for vaccines. We'll also be able to build that into our school entry approach that has helped make Rhode Island so successful. And then what we are also engaging in is our healthcare worker requirement and businesses outreach. We really want to help our stakeholders have the tools that they need to be effective in making the places safe, making people feel comfortable and confident to go out into the public, to engage in our commerce and our businesses, to go to our healthcare facilities, receive the services that are necessary, and do it in an environment where they know they will be kept safe. So that's a key part, and our boosters, as I mentioned, will help support that. I know the biggest policy that people are most interested in and that we see as being extremely effective in setting the stage is our healthcare worker vaccination requirements. So I want to talk a little bit about that and what our enforcement strategy is. Similar to what our approach is with vaccination-related policies overall, we have two major goals that are constantly in the forefront. We want to ensure safe healthcare settings protected against COVID, so that there are as many people vaccinated as possible working in those healthcare settings, and patients and families can be confident that they are not going to be exposed to COVID by going into those healthcare settings, and can continue to engage in receiving the care and services that they need while sustaining high quality care across a stable healthcare system. So we want to make sure the environment is as safe as possible and make sure we do it in a way that maintains the high quality care and stability of our healthcare system to be able to do that. We always want to make sure, as you've heard from Dr. Chan, and just understanding how the Rhode Island Department of Health, how we move in doing our work, it is always based on the data and the science. And so we've included examples of studies that show how effective COVID-19 vaccination is at preventing hospitalizations. The new information, we're also learning about preventing transmission of the virus, and even for those who have already been infected, being able to help reduce reinfection is an advantage that can occur with the vaccination. We also wanted to emphasize how we are in the lead in terms of states throughout the nation. All of my public health counterparts and colleagues are absolutely recognizing the same phase, the importance of advancing this critical public health tool within the realm of policies and requirements and helping to shift the culture. So you see the number of states that have incorporated healthcare worker vaccination requirements for the various facilities, and all requiring vaccination within the same time frame that we are in now in September and into October. So we wanted to provide some quantitative data as a starting point for where we are. We're still just in advance of our October 1st time frame, and we want to make sure that we are well positioned to achieve the two goals that I shared: making our healthcare environments as safe as possible with as many people vaccinated against COVID, providing care for our most vulnerable patients, and ensuring high quality care with a stable healthcare system. So what's key about this slide is understanding how well positioned we are to start. On September 2nd, we did an assessment of what our vaccination rates were across all of our 415 healthcare facilities, and at that point saw that 76.6% were already vaccinated against COVID-19. We repeated that assessment from September 2nd to September 13th and saw that it's working. Where we're going is working, and implementing the enforcement of this October 1st is having the impact that we need, because there was a 10-point increase from September 2nd to September 13th in terms of the healthcare workers who have been vaccinated. It's now at, as of September 13th, 86.6%. So we want to continue to drive it to full compliance by the time of October 1st, but want to also acknowledge and celebrate all of the facilities and healthcare workers who are out there recognizing the importance of our responsibility in this field to ensure that patients are as safe as possible. One of the things that we did with a part of this assessment also is get more qualitative information when we dug in deeper on those facilities who were less than 80% vaccinated. On September 2nd, that number was 69 facilities, and on September 13th, it had decreased to 41 facilities that were less than 80% vaccinated.
Excuse me, Doctor. I was going to wait for questions until after you made your presentation. But something just came up. Representative, please.
Thank you, Chairman. Director, so based on the numbers you're showing us, the total percentage, I just wanted to make sure that I'm making sure this is totally accurate. I've been told by people in the field that if they're not vaccinated, some of these people have left their jobs. So the total number of healthcare workers at a particular point in time, I believe 9/1, 9/2 time frame was the first round of layoffs or firings that took place because of the mandate. So I'm wondering, have you accounted, is the numbers we're showing, so the vaccine rate as of 9/13, are those accounting for employees that have already been fired because of the mandate, or are you just assuming the number of employees have remained the same as of the first date in which you present the numbers for?
We are basing the results on what the healthcare facilities have informed us of, so they should have been telling us on September 2nd what their number vaccinated is based on what their denominator is at that time, and then also on September 13th. They should have told us that number. I do want to clarify that no one has been asked to be fired at this point in order for it to come into compliance with our healthcare worker requirement. October 1st is the date. People have up till September 30th even to get the J&J vaccine and be able to still qualify. So that number should be very small unless employers had other reasons to let someone go.
And we will hold off on questions until after your presentation.
Thank you, sir.
Thank you.
So the qualitative data, when we assessed among those facilities that were less than 80% vaccinated on September 2nd, what additional information we could entail. 54 responded to our inquiries, and we saw that 8 of them reported some form of impact to operations that they are concerned about, and fully, that is 2% of all those who have responded to us. So being able to see how small the number is that there is concern about operational concerns is important, first and foremost. And then second, that also helped inform what our enforcement approach is. We are requiring that there is 100% compliance by 10/1, and we're very encouraged that this qualitative data relayed the majority of healthcare facilities noted that they do plan to achieve the 100% compliance by October 1. We also were able to take into account the additional feedback when we asked what any main concerns were, what were they doing to close the gaps, and how were they going to ensure the high quality of care that is the key to our goal with this process, and then take that information to inform what I'm going to describe next, which is our enforcement strategy. So enforcement implementation begins October 1st and is intended to have all facilities be compliant with the regulations. That is our full expectation come October 1st. Similar to how we approach all of our enforcement as a regulatory body, we are going to take a deliberate approach and a tailored one in how we are implementing our enforcement strategy. To mitigate risk to patient outcomes, that is to ensure that we maintain the stability of our healthcare system as we go through this process, our second goal, we are requiring any facility that is concerned about being non-compliant, which is a small number based on what they had reported, to be accountable to a corrective action plan that the Rhode Island Department of Health will enforce. Our approach with doing this is to ensure that if patient outcomes are at risk because critical staff are non-compliant, facilities will have this opportunity to maintain the stability of their healthcare system and submit a corrective action plan so that they come into full compliance within 30 days. I will be clear, this is only limited to a certain number of facilities and will require the type of close work with us as a part of the enforcement strategy. And I will be clear that every healthcare system will be accountable to the public. We are approaching this in a way such that Rhode Islanders will know which facilities are compliant come October 1st so that they are able to make the appropriate healthcare decisions they need to make for themselves and their families in keeping them safe. So that's an important component of this. So October 1st, we will be requiring an attestation from facilities and licensees where they can attest to being compliant, fully compliant by October 1st. And we will publish that so that everyone will know transparently all of those compliant facilities that are present throughout Rhode Island. The non-compliant facilities and licensees will be required to articulate a corrective action plan that requires them to come into full compliance within 30 days. Examples of what will be required as a part of that corrective action plan that would also be due October 1st includes the facilities plan with the timelines within those 30 days within which they will ensure that all healthcare workers will become fully vaccinated by that time frame. Demonstrate that any unvaccinated staff who are still working are only doing so because they are essential to the facility's operation and maintaining safety and patients' outcomes not being negatively impacted. They will also need to specify the additional infection prevention measures that the facility will be taking regarding any unvaccinated staff who are being required to get into full compliance during this time frame, and outline the facility's procedure to ensure that any new hires who are brought on are already fully vaccinated against COVID-19 for going forward. That will be a prerequisite for being hired. And then within this corrective action plan timeframe of the 30 days, we will be escalating any enforcement as we see fit that taps into all of the elements across our regulatory authority to ensure the accountability to the corrective action plan and achievement of full compliance as soon as possible and no later than that 30-day time frame. For next steps with that approach, so that everyone's aware, we have been engaging with stakeholders such as yourselves as well, trade organizations, and the public to make clear this enforcement strategy starting the week of September 13th. We will also be disseminating the corrective action plan template to facilities next week, and then activating the website for communicating facilities that are compliant so that we can enable all Rhode Islanders to make fully informed decisions on where they receive their care. And come October 1st, enforcement will be fully activated. So I will finish with a few quick updates on K through 12 and our outreach to businesses. That's been critical to our overall policy approach. We know that low COVID-19 transmission rates actually exist in the school setting. It is rare, less common for transmission actually to occur within schools. And we learned that by seeing from September of 2020 to July of 2021, only 5.4% of positive cases among Rhode Island's pre-K through 12 students and staff were reported as documented school-based only exposures, only 5%. All the rest are related to community exposures, which is why high transmission rates, as you'll hear more about also from our next speaker, Dr. Fine, are critical pieces to being able to control the spread that's in place. One of the slides that's very educational to equip the public with, particularly parents and families in our school community, is the understanding of compliance with the prevention strategies that we know work. That's the key message that we can share. What we learned last year is what's going to help us to get through the rest of this time. Vaccination, indoor masking, ventilation, active testing, those are prevention strategies that work, and we want to make sure that families, school communities all can work together to make sure in every district that we are fully implementing, strictly enforcing, effectively carrying out those prevention strategies. This graphic shows it's not just about having the prevention strategies and knowing them on a policy, but it's also following through and implementing them as effectively as possible. The red shows what happens with new cases per day among our unvaccinated as of today. Thankfully, we'll hopefully get updated information on that. But among children 5 to 11, when you have no prevention strategies in place, during this peak time, we could be experiencing thousands and thousands of cases per day. And that's whether we document it or not, because oftentimes children are asymptomatic or don't go get tested. But showing how prevalent the Delta strain is, particularly when it's in a population that is unvaccinated, can lead to thousands of cases per day. If we have the prevention strategies, which is the yellow line, but don't implement them effectively, consistently, and with the full compliance that we know is needed, we can see some decrease in those cases, but still be dealing with a few thousand. It's really achieving what we have been and can do on the green line going across. We know what the strategies are. Families, school communities, businesses, everyone working together to implement them effectively and keeping that going consistently is what's going to make it so that we don't have the increase in cases. This is just a few hundred cases per day. That is absolutely doable. That's the key message to talk about with masks, with public schools. We issued the indoor masking policy. That's one of our critical prevention strategies. It's vaccination plus these steps in order to have that bottom green line that's in place. So our community working together to ensure everyone is doing this effectively in our schools is what's going to make the difference. We know about the science behind masking. We know that it works. It blocks the release of exhaled virus. We know that mask wearing does not cause significant adverse health effects for wearers. Our children have been able to do it amazingly. It saves lives. It makes a difference. It's an easy, doable tool. That's key to public health. What's a tool you can use? A seatbelt, indoor masks work to be able to help keep our line the way we need to, that green line going across with as few cases as possible. Here are the successful prevention strategies that we knew worked in 2021. We're continuing it again. We distributed 6,000 plus HEPA filters to schools to make sure they had ventilation going. We know masking is critical indoors. Our testing program is leading in the nation. That continues to need to be accessed, and our EPI operational team does amazing, amazing work with case investigation and contact tracing that's critical to follow. So really understanding that schools, the public, all of us can work together to ensure that we are complying with these doable prevention strategies. That's going to be the way to keep our schools open successfully, to keep our economy thriving, give people the confidence to go out to businesses and participate in the economy. It's ensuring vaccination, distancing, masking, ventilation, testing, all of the steps that we need to do. And that's what we've shared with our businesses. There are 4 key tools you can do. Being able to do that allows you to, with confidence, tell your consumers, tell your employees, this is a safe place to come to. Let it be known. You can still come out safely doing this in COVID, even with the high transmission rates that are there. If businesses work on getting vaccination policies that require their employees to be vaccinated, even consider requiring vaccination to enter, you can say that's a safe place. Having testing programs available for your employees, for customers, we have that as a resource that's there. We want to support businesses in being able to do the different types of ventilation approaches that work. Many are already doing it. Let's make sure every business has that opportunity. And indoor masking is such an easy tool to be able to put into place. Doing all 4 of these give businesses the top notch in being able to say, with confidence, here's a place you can come to and feel safe and shop and eat and do all the things that we want to encourage throughout Rhode Island. We know we can get through this together. We have the tools, and it's our focus based on data and science to make sure you have it and know vaccination, indoor masking, testing regularly, and ventilation. Those are going to be the keys to get us through this safely. Thank you.